Hello. Good morning. Thank you for choosing Midwest Dental Associates. Did you already get checked in up front? Okay. And what's your name? Alright, it looks like I have you in the record book right here. And let me just get you marked down. Okay. So it looks like we have a routine checkup and a cleaning for you today. Does that sound right? Okay. And I do just have a few questions. How often do you brush your teeth? And you should be doing it after every meal or at least twice a day. Okay? Alright. And how often do you floss your teeth? Okay. We do need to work on that, okay? Do you ever use mouthwash? Okay. Gotcha. And do you suffer from excessive stinky breath, other than the kind that you would get in the morning or after you eat onions or something? Okay. Have you been experiencing any tooth pain or any tooth sensitivity? Okay. All right. And are there any other concerns that you want to address with me during this appointment? Okay. Excellent. Well, I think I have that all together. So I do want to get started and just check out your mouth a little bit first. I am going to put on a mask so I don't breathe onto you and you don't breathe onto me, and some gloves to protect inside of your mouth from germs, okay? Alright, so let me get this mask put on. Get it nice and snug. And I have some gloves here. Okay. Alright. Okay, very good. So the first thing that I'm going to do is use this little tongue depressor to take a look down in your mouth. And I have a flashlight here that I'm going to use to get a better look, okay? So what I need you to do is just get back, get comfortable, and open your mouth real wide, okay? Say ah. Okay, excellent. Alright. Okay, good. Yes. Good. I'm just trying to look back a little bit into your mouth. Very good. I'm not seeing any cavities, so that is excellent. Okay. All right. That does look pretty good. So the first thing that I want to do is show you how to properly brush your teeth. Okay, and we're going to get the fronts, we're going to get the sides, the tops of all your teeth, behind, and then you can use a tongue scraper, or some toothbrushes like this one do have something on the back that you can use, okay? Alright, so I'm going to go ahead and just brush these for you a little bit. Just relax and keep your mouth open. Okay. Good. Okay. Very good. Other side. Okay. Very good. All right, now let's get your tongue. Okay. Okay. Good. All right, and I'm just gonna get the insides of your cheeks, okay? Just gently. And I do recommend that you use a soft bristle toothbrush so you don't damage your gums at all, okay? If they're bleeding, that's not a good sign. Okay, very good. All right, now I do have some water for you. So you can just use this. Good. And gargle and spit. Okay, very good. And I know that you are having trouble flossing daily. It is really important to floss daily. It doesn't just get food and particles out from between our teeth, it also gets the plaque away, okay? It helps prevent infections and cavities and all sorts of stuff. So it is really important that you do it, okay? If you aren't enjoying the traditional floss, there are water flossers now that you can use. And then we also have this kind of pick floss. I can let you try one if you'd like. It just looks like this. And then this is the kind of traditional floss, but you don't have to worry about wrapping it around your hands. And then this pick you can use in between the teeth, okay? All right, let me just use it as an example. I am going to scrape your teeth, so we'll get all the rest of that later. But let me just show you. Right, just like that. And you don't want to come down too far and hurt yourself. Okay, very good. If you do need a sample, we can send you home with a few of those, okay, if you want to try them out. Okay, but you can get them for about $1 or $2 at the store. All right, so next I am going to use my little scrapers, and I'm just going to scrape the plaque off of your teeth, okay? All right, we're gonna make them look good as new. Okay, so again, I just need you to open your mouth wide. Say ah. Okay, very good. Let's get started. So, did you grow up around here? Oh yeah? Well, what city are you from? You know, I've never actually been there before. I'd love to go though. I'm doing that typical dentist thing, huh? Where we make you answer questions while we have tools in your mouth. Okay. Okay, good. We need to get some better fitting masks for those of us with little tiny heads. But I am new to this practice, so we will get that. Okay. So I am actually from this area. Yeah, my whole family is from here. I went to high school here. And college. Yeah, just the next city over. It is really a peaceful kind of place to live, so. Have you lived here long? Sorry. Sorry, you don't have to answer. Okay. Alright, I will have to get a little bit closer to do the top teeth, okay? I'll keep the mask on, so don't worry. I'm not going to get my germs on you. Okay. Very good. I know that a lot of people kind of have a fear or an anxiety about going to the dentist, but we try to make it really calm and relaxing here. So I hope that that does ease any anxiety that you might have had about the dentist. People sometimes have really bad childhood experiences, so we want to improve that. Okay. Good. It's surprising how much plaque builds up. That's why it is so important to come back every 6 months, okay? Yes. Good. Okay. That does look just about done. Alright. So you can just take a break, close your mouth. I know that that was a long time to keep it open. So I do want to tell you that you should make sure that you are brushing your teeth. Preferably after each meal, but it's okay if you do it just twice a day. And it's really important that you do floss your teeth because a lot of people don't realize it. But our dental hygiene and dental health affects a lot more than just our mouth and just our teeth. Obviously, it's cosmetic. It affects the way that you look and you feel about yourself. But if you do get pain, that really affects you. You know, sharp dental pain. Ooh. And if there is an infection, that can spread to your bloodstream, and it can be very, very detrimental to your health. So do take care of yourself, okay? Okay. So next, what I want to do is to apply some fluoride gel. and that will help protect your teeth. It'll help strengthen them against cavities, okay? All right, so I have this cream right here. Fluoride does come in many forms, but we opt for the gel cream. It's just easiest, easiest to handle. So I will go ahead and take this swab. And if you can go ahead and open your mouth for me again. Okay. Good. Okay, very good. We do want to make sure that your teeth are coated. Yeah. It is very important. And you are lucky because you have very good dental insurance. And it completely covers the cost of the cleaning, the exam, and the fluoride. Some people's insurance doesn't cover fluoride treatments, but we do recommend that everyone gets them anyway. And they do only cost $15 so at our clinic, so that's very reasonable when you think about how much pain and money it can cost to repair a tooth. Prevention is always better. Okay, very good. So I'm going to go ahead and just close this now. Very, very good. You have to let it set for just a couple minutes, and then if you need, you can have some water. Okay. I am actually done with this mask now. That exam wasn't too painful, was it? I can take these gloves off. Okay. You did an excellent job. I know it can be kind of a pain to have to sit there with your mouth open for so long, but we will send you home with some of those floss picks for you. Just test them out, see, maybe they'll help you actually floss every day. If not, I can recommend that you get a water flosser. Those are electronic, and they unfortunately are not provided for free from this office. But I do want to give you a full-size toothpaste to take home with you. This is Enamel Health Multi-Protection, and it is really, really important that you are protecting the enamel on your teeth, okay? And this will also help keep your teeth white and sparkly. It will freshen your breath, but it is really, really important that you protect that enamel, okay? So we will send this home with you, and those picks as well. And do remember that I recommend that you use a soft bristled toothbrush. Okay, and if you'd like, I can go ahead and get the 6-month appointment set up for you right now. Would that be helpful? I know sometimes it's hard to remember. Okay, let me flip back to your chart. So many patients. But I really love it when people are getting to the dentist because sometimes they neglect it. And it's not something you want to neglect. Okay, so it does look like we have 6 months today free, we also have that whole week. So is there a day, maybe a Monday, Wednesday, or Thursday that works best for you? We can do Tuesdays, but we close a little bit earlier. Okay, yeah, that'll work. And would you like an early morning appointment, an afternoon? Yeah, the whole day is free, so I can set you up at 8:30, 9:30, 10:30. We can give you a 1:30 or a 2:45 p.m. Okay, perfect. And you will get an email reminder about this. So if you find out that it's not going to work with your scheduling, I know we are planning pretty far in advance. You have 48 hours before the appointment to cancel, but as soon as you find out, you can give us a call, okay? Absolutely. So thank you for coming in again. It was a pleasure to meet you. And I will see you again in 6 months. Take care. Goodbye.